Thanks for the invitation and hopefully have something interesting for here tonight. It was very interesting to see Hannah talk, so I hope I can keep up with the pace here. So I guess the title that was on the agenda is a little bit different. I guess Dr. Wood had talked to me a little bit about like fiber and ruminal acidosis, but also a little bit about wheat in finishing diets. So I kind of put together more like feeding and management strategies, kind of going to cover a little bit around all the areas that I think it's important and then have some of like examples of the studies that we kind of have been working on this area that kind of support a little bit uh, these managements or strategies to reduce ruminal acidosis and increase performance in finishing feedlot cattle. So when we think about finishing feedlot diets, when we look at it, we're feeding usually high grain, high energy diets, right? On average, between 6 to 12% forage or roughage in that diet dry matter basis, right? So not a lot, quite small proportions, and in some cases can be less than that, right? Depending of what you're feeding. And the objective of those diets, when we look at it, is to really uh, increase energy intake of cattle so we can get higher weight gains and increase as much as we can feed efficiency so we can decrease cost of gain, right? But at the same time, we want to make sure that we also minimize digestive disorders and liver abscess and other issues associated like laminitis and so on. So a lot of things that we need to think about to really ensure that cattle can grow and perform well without having problems and at the same time at a low cost, right? And be profitable in the end. So why do we care about ruminal acidosis? So when we look at it, um, ruminal acidosis has been shown to promote variable feed intake, reduced short-chain fatty acid absorption, and cause pro-inflammatory responses in cattle. And then that leads to decreased growth performance, decreased carcass weight, and increased overall variability that we see on cattle, right? At slaughter, and that leads to reduced profitability. Associated with that, we see more liver abscesses, laminitis, and lameness in cattle. And we also have mortalities that are a result of acidosis, right? So a lot of issues that we care about, but it's also an animal welfare concern, right? So it doesn't look really good if we don't care about it and we don't do anything when you think about consumer perception, right? So we really need to worry about those things and try to do the best we can to minimize that because when we consider all of that, it can bring a large economical impact to your operation. Before we get too much into to ruminal acidosis, it's important to kind of get into a little bit on the definition of that. It's hard to measure ruminal acidosis, right? Like, not a lot of people like on farm would be looking at that or measuring that. We do on research. We can put like a pH probes inside the rumen of cattle and measure over time pH of cattle, so we know exactly what's going on. But still, in research, we can do that in a reduced number of animals. We usually don't have very large numbers to do that, which reduce a little bit the capacity to really do large scale work. And because there's so much animal variability, it's really hard to look at that. But in general, we're talking about a reduction in the ruminal pH of cattle, right? And it's not just a reduction in ruminal pH, because when we look at it, there is cattle that can deal with quite low ruminal pH and show no effect or have no problem with that. The problem is when you have that reduction in ruminal pH, and as a consequence of that, you have some systemic inflammation. And we're going to discuss a little bit why that happened. But then associated with that inflammation, then you're going to have the impact on intake and have secondary disease that happens that will be a problem that can lead even to mortality if we don't take care of it. So that's the problem, that reduction in pH and the systemic inflammation. Usually, we break down ruminal acidosis in acute ruminal acidosis That's usually a less common problem, but much more serious, right? So usually in finishing feedlots, wouldn't see a lot of acute ruminal acidosis, but it can happen. But but the subacute ruminal acidosis is what it's really the problem, right? That we have quite a bit, and it's hard to detect. There's not a lot of signs out there, so you need to understand a lot more about the issue to understand to be able to figure out what's happening. But when we look at subacute ruminal acidosis, even on research, there's a lot of debate what that is. There's not like a large consensus. So usually we consider subacute ruminal acidosis when ruminal pH of cattle gets between 5.2 and 5.5 or 5.6. But I've looked at a lot of ruminal pH of beef cattle, and when they're on high grain diets, it always go down in that range. Just going down for an hour or so or for a few minutes, there's not really a big problem. It's normal and it's not really, I wouldn't consider subacute ruminal acidosis. The problem is when it goes down between that range and it stays for a longer period of time. So usually over 3 hours, we start to worry more, right? Um, so that becomes more of a problem. So really, most of the time when you're looking at finishing feedlot cattle, we're focusing on trying to minimize subacute ruminal acidosis. Is a very common problem that can cause some of those issues we discussed earlier. Getting more at looking at more simplistic at the etiology or the cause of this issue, right, of ruminal acidosis, is basically an imbalance between acid production and acid neutralization, right? So we have a lot of like fermentable uh, organic matter or feed that's highly fermentable, reaching the rumen and producing a lot of like short chain fatty acids, and that reduces pH. Cattle usually tries to neutralize that by producing saliva, buffering by saliva, but also there is a lot of buffering that's released in the rumen through the absorption of those short chain fatty acids, and through the passage or when those short chain fatty acids leave the rumen. Uh, Whenever one gets more than the other, then we have a problem, right? When we have more acid, then the ability of cattle to do that neutralization problem, that becomes a problem. So basically, that's an example here. What's happening? You have saliva coming, and that bicarbonate from saliva kind of buffering the rumen. You will have some short chain fatty acid absorption that will help kind of reduce that pH or buffer. And you will have also some exchange during that short chain fatty acid absorption with bicarbonate being introduced in the rumen that comes out of the blood and gets into the rumen, and a lot of the bicarbonate will come through that route. Very often people think that saliva is most important, but when we're talking about finishing feedlot cattle, this will be the most important route here for buffering that rumen. And then we will also have more absorption of short chain fatty acid, but also we will have that short chain fatty acid or those acids leaving, passing to the lower digestive tract. And then all of that helped to decrease pH. But when we have a situation where that's not enough to buffer that rumen, then we can have reduced pH and acidosis happening. So here's just a study that shows the importance of that absorption through of VFAs through the rumen epithelium. So have a lot of like a surface area of absorption is going to be really important to maximize the buffering from this source here, because you can see here on a high roughage or a high concentrate diet. On a high concentrate diet, this is the amount of in grams per day of bicarbonate from saliva, and this is the amount of bicarbonate per day coming from that transfer to the rumen epithelium. So really important that you have a really healthy rumen epithelium to maximize this and and be able to buffer well the rumen. So that's why adapting and stepping up cattle to high grain diets will be so important. Another point, we talk about ruminal acidosis, but we now accept and know this really well that it's not just ruminal acidosis that's happening. At the same time that you have ruminal acidosis happening here, this is comparing animals that they were on control animals that did not have acidosis with animals that were on acidosis. You can see that You have that ruminal acidosis, but you also have hindgut acidosis, cecum, colon, all of those. We were able to measure lower pH. Um, and that is interesting because when we look at the epithelium of those of the intestine and compared to the rumen has a much more it's much more adapted to deal with acidity, right? You have that you can see four layers of different cells here, and it's a keratinized tissue that is really adapted to deal with like a lot of like challenges. And when we look at the intestinal epithelium, we have just one layer of epithelial cells, and it's they're more sensitive and lower pH here. If you cause damage here, you're probably more likely to get pathogens and the toxins kind of like being able to pass through that barrier and reach the circulatory system and the blood of cattle and leading to inflammation and secondary disease, right? So this is a problem. And very often when we have acidosis happening in cattle, what we see is in feces, we usually see softer feces a little bit more. But on the top of that, you can see in that feces, if you run your boots through that, sometimes you have these slimy things that if you take and wash that, it looks something like that. What we call this is like mucin casts. Those are produced when you have any irritation to the large intestine there, and these are produced. So whenever those cells are damaged, the intestine needs to produce more cells to kind of heal that epithelium. So they produce that mucin cast to cover and protect that epithelium, so that can recover. When it recovers, then cattle starts to eliminate those mucin casts in feces. So the only issue is this is an indication that you had an issue, but it's usually after the fact, so it just happened. But it gives you an idea if you get to a feedlot with a lot of that, they're having some issues in their feeding management that's causing that acidosis to happen. So when we look at the cause of ruminal acidosis, we talked about that balance between VFA production and the absorption, passage, and buffering. But what leads to that? What causes that? So usually we always talk about excess of grain or non-fiber carbohydrate to the diet. That's one point, but it's not just that, right? Um, we know that the rapid increase in non-fiber carbohydrate or grain in the diet without proper adaptation or that change in diet very quickly is a problem, right? But also insufficient fiber to the diet. Or not very common, we can have highly fermentable forages, but that's not usually the most problem. But and when we talk about that insufficient fiber, coarse fiber to the diet, very often where people are thinking about the chewing and salivation, which helps buffer the rumen. But one of the important points of that is you replace when you have coarse fiber and more fiber in the diet, you replace some of the fermentable, very fermentable carbohydrates. So that's that dilution of the diet in terms of energy and how fast that energies get released in the rumen or fermented. That diet gets fermented in the rumen is quite important too. And also that coarse fiber also helps also with rumen motility, and that motility of the rumen also helps with absorption of VFA, exposing those short chain fatty acids to the ruminal epithelium and absorptive surface there, and then promoting more absorption and buffering in the rumen. So there's a lot of like benefits of having some of that coarse fiber in that diet. Um, Other problem we have very often we see cattle sorting that forage out of the diet. It's really common when you have very large forage particles on this. Another way that we see that often happens when your forage source or your roughage is very dry, that then doesn't mix very well, and cattle can sort that very easily in the bunk, right? And sometimes they don't eat that forage, and then they're gonna get a lot more fermentable carbohydrate than you wanted. And recently we've learned a lot about this, and it's one of the easiest way to get cattle to develop ruminal acidosis in research is when you restrict feed from cattle for for a period from hours to days, uh, cattle get hungry, and then when you refeed cattle or you feed them again, they overeat and develop acidosis just because there's a reduction in ability of cattle when you restrict feed or they get off feed for a bit, and then that reduction in ability to absorb associated with the increase in intake and the increase in the amount of short chain fatty acid that's produced in the rumen will lead to that ruminal acidosis. So that's one of the biggest challenges we have nowadays is trying to make sure that doesn't happen. And very often people always talk about high grain, but it's not simply just the high grain too, right? It's about the amount of grain, but also the type of grain that you're feeding. If you're feeding corn or if you're feeding wheat, it's very different, right? So we need to be careful with the type of grain and also with the processing of grain, of that grain. So if you're feeding corn that's whole, is very different than rolled corn, that's very different than high moisture corn, and that ability to ferment and how fast it ferments in the rumen, right? And the same thing with wheat here. You can see a dry rolled wheat is like the most challenge we have, right? Wheat has a starch that's really very easily fermented when that kernel is broken. If you dry roll, there is usually a likelihood of producing a lot of fines when it's rolled, and that's a big problem. So really being able to, when you process grain, control the amount of fines that's produced is essential. We've seen like the relationship of fines, the amount of fines you have in a diet with acidosis is quite high, and being able to reduce that's going to be essential. So based on trying to understand how to best process grain, especially wheat, we did a study that we tried to look at the processing method and the wheat type. We focus on two very contrasting type of wheat. One was a wheat with a high protein content or in high hardness, and another one was the wheat with lower protein content and high starch content and lower hardness. And we look at the risk for acidosis and growth performance. So here you can see the composition of the high protein wheat, 18% protein, 54% starch, and the low protein wheat was 13.5% protein and 57% starch. And that's what they looked like. So this high protein was a mix of red spring and red winter wheat. And the low protein was a soft white spring and hard white spring wheat. And then we processed those two wheat sources uh, with dry rolled. They were dry rolled or temper rolled. So temper rolling is just adding water to that wheat and letting it soak in water before rolling, right? So usually we add water to increase the moisture of that grain to 20%. And let it soak for 12 to 24 hours. Then we roll that, and by doing that, that moisture prevents that grain shatters and produce a lot of fines. So we can, by doing that, reduce a lot of the fines from processing the wheat or any other grain. This is the results of the processing of the grain. So we have the hardness of the high and the low protein wheat. So you can see they're quite different from each other in that way. But look at when we kind of put that samples through sieves, you can see that the larger particles on the top and the finer particles on the bottom of the dry rolled wheat, you can see that we are able to reduce it quite a bit by temper rolling it for both types of wheats. But it's also interesting to see that our high protein wheat, which have a higher hardness, has a lot more fines when we dry roll it than your low protein wheat. So if you're working with a high protein wheat, your chance of having in your dry rolling, your chance of having acidosis is much higher than a low protein wheat, right? So understanding that helps you kind of plan and figure and decide what type of processing you're going to do and what or management you're going to do to reduce the risk or challenge that you have with ruminal acidosis and prevent some negative consequences later on. Um, So when we looked at the ruminal pH during the transition phase or step-up phase of cattle with that wheat diet, this is just a comparison of the high protein. There's no, I don't have the low protein wheat in this figure because we didn't see a difference of effect of processing for the low protein wheat during the transition phase. But for the high protein wheat, we saw an effect of dry rolling in yellow versus the temper rolling in green of the time or duration that pH of cattle, the rumen of cattle was below 5.6 and pH below 5.2. And you can see by temper rolling for both durations, we saw a strong reduction in that just by doing that and reducing that amount of fines in the rumen. So that was really an effective way of reducing acidosis that was happening during that step-up phase. One other interesting thing we saw during the growth performance in that finishing phase after cattle was adapted is that that high protein wheat it promoted like lower ruminal pH, it promoted lower intakes, and also promoted lower average daily gains compared to that low protein wheat that was high in starch and had less fines. So that is something that was quite interesting that we saw in the end. And then when we look at the carcass traits, we saw that we had a greater dressing percentage for the low protein wheat compared to the high protein wheat. You can see here the average was about a 0.5 or 0.5% greater here. We also saw that processing, temper rolling, increased the rebuy area. So we think that we likely promote better ruminal condition, maybe better ruminal microbial growth and efficiency, and then that led to more ruminal microbial protein being absorbed by cattle in the intestine and leading to more muscle deposition that led to greater muscle area. So it's kind of interesting that you can change so much by adjusting that processing. Another interesting thing we saw is um, the liver abscess of cattle on that high protein wheat diet was much greater, or at least the severely abscessed livers were much greater for the high protein wheat diet than the low protein wheat diet. So that diet had a lot more fines shattered. It caused a lot more issues in terms of liver abscess than a diet that they said had the same amount of wheat, but had a wheat with more starch than this one, but much less issue with severe liver abscess. And the severe liver abscess is what's our real problem, right? That's the one we want to reduce as much as we can because that impacts carcass weights and other things. But that was kind of interesting. So moving on a little bit, kind of going back to that feed restriction idea that we were talking earlier. Um, Dr. Penner here at the University of Saskatchewan has done a bunch of work in this area, and he summarized all this work in this figure. And it's interesting that helps understand a little bit what's happening. So whenever you have cattle on a high grain diet, and then you have some feed restriction, for some reason, you might have a truck that broke down and takes a while to kind of get things figured out, or you might have cattle that get sick, or you might have something that um, some issue that, for example, transport of cattle or anything that you prevent cattle from eat normally or accessing feed. You might have an environmental challenge or something like that. That's going to reduce intake for a little bit. That will drive reduction in absorption of cattle and ability to that rumen and gut to absorb. But that also, after you restore feed and cattle can eat ad libitum, it takes a while for that dry matter, a week or two for that dry matter intake to go back to normal levels. But that dry matter intake goes back quicker than what we see the absorptive capacity of cattle. So we talk that absorptive capacity is so important to maintain or help buffer that rumen. And then with that, you have a higher chance of getting ruminal acidosis and then having more issues with cattle. So really trying to prevent any condition or any situation that drives feed restriction or get cattle off feed will be important. Another thing is when we look at that, like those situations that drive cattle hungry, or 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 that feed restriction that makes cattle hungry, makes cattle, whenever we provide that feed, not just go back to eating what they ate normally, very often they eat more than they would eat normally, and they overload that rumen, and there gets a lot more of short chain fatty acids produced, and then you get anywhere from a mild to severe subacute ruminal acidosis happening. uh, and then they don't eat again because they don't feel good, and then they get hungry, and then they eat too much, and they get in a cycle, and this process repeats over time, and then you can have a situation what we usually call chronic acidosis, and it's going to be those animals that persistently don't perform well. They're like consistently like looking worse than the other cattle, and not going to do well in the feedlot. And when we look at what happens in the rumen, compare ruminal pH with intake, we very often see like in ideal condition, animals will have many meals throughout the day, and the meals won't be very, very large. And then that pH is going to go down, but not too low, and then it's going to go back up. And the next day, when you feed again, it's going to go down and back up, but it's not going to go below that 5.5 for too long. And you can see here just this feed intake, kind of feed disappearance slowly throughout the day, and then you feed again and feed disappearance going slowly throughout the next day. But then when you have erratic feed consumption, or animals get hungry, like we said, animals go on feed and eat very quickly, a lot. And you can see that they have very few meals throughout the day. That pH takes a little bit to go down, but when it goes down drastically, and it goes much lower than 5.5, and it stays down for a long period of time and takes a long time to recuperate. And then the next day, because of that, cattle don't eat. So we really need to avoid that as much as we can, avoid these issues as much as we can if you want to have cattle healthy and performing well in the feedlot. But then there's the roughage inclusion. We know roughage is important, or forage is important in feedlot diets for that rumen health, but we know that's essential for that, right? But why do we always want to reduce that? We want to reduce because we know that if we increase diet energy density, we can increase average daily gain, we can increase gain to feed, we can reduce cost of gain, right? We can shorten the time need for cattle to reach a slaughter weight. We can improve carcass quality grade, dressing percentage, marbling. So there's a lot of reasons to do that, right? But then we need to make sure we manage that with not increasing a lot those other issues, or even mortality in the feedlot, right? And also consider that welfare concern that we discussed. So when we look at, like I summarize here results of some recent studies in this area looking at roughage or forage inclusion in feedlot diets. And here in this set of graphs I have, it's expressed as percentage of forage as a percent of the diet dry matter. And in the second set of slides here, of figures here, I have percent of forage NDF as a percent of the diet dry matter. So percent of forage fiber NDF as a percent of diet dry matter. And you can see that when we look at gain to feed, as you increase forage, it goes down, right? So there's a reason to kind of try to reduce the amount of forage as much as possible. And you can see that at the same time as you do that, increase fiber or forage, the dry matter intake of cattle increases because they're trying to reach or eat similar amount of energy. There's just one weird study here that goes down here, a kind of curvilinear kind of shape of the curve, and that's because this study here by Swenson, they used the automated feeding bunk, like the grow safe bunks, and as they added more fiber, they had a bulkier diet, and they didn't have enough space, and they didn't feed cattle enough. The cattle was restricted on feed. So this is an outlier. This study is an outlier, so this data wouldn't be great, but all the other studies you see that increase. And then when you see an average daily gain, you see that more like a curvilinear shape where you have in the middle here better average daily gains. And you can see by looking at for inclusion of roughage NDF in the diet, we are able to tighten up and reduce the margins, so we can figure out better how much forage we need to be including in the diet. And a lot of those studies, kind of when you look, it's around that 5-6% forage NDF inclusion in the diet dry matter. And this data aligns really well with older review by Galen and D4 here, where they looked at the same thing, and you can see dry matter intake as proportion of forage NDF increase in the diet dry matter, very similar to what we see in these studies here with newer data. So forage in NDF is an important and is an easy way for us to figure out how much to add to the diet, but it's not the only thing. We've recently here at the University of Saskatchewan, together with Agriculture and Agri-Food Canada, and even University of Guelph, people have done a lot of work trying to looking at NDF a little bit deeper, and we divide that into physically effective NDF and the undigestible NDF. So when you look at that PE and DF, it usually is related to the amount of forage you include in the diet and the particle size of that forage. It's really what caused that scratch factor in the rumen. And the UNDF is more related to how undigestible that fiber is, right? It's related to physiological state of that fiber and the feed quality, right? But both of them can stimulate rumen motility, rumination, and increase salivation, promote more buffering, right? So there was a lot of interest to try to better define fiber inclusion in the diet by looking at those things. Uh, we don't have a lot of time, so I kind of try to summarize the results of these studies here in this slide. So what we found is that both PNDF and UNDF contributed to ruminal pH, ruminal motility, and helped to control or improve permeability and reduce inflammatory markers by increasing PNDF and UNDF. However, we saw that UNDF increasing UNDF was not great because it led to reduced performance of cattle, right? And that makes sense. You're adding more undigestible material to the diet. So we've seen that we don't want to pass much more than 7% of UNDF on that diet, usually lower than that, because that can cause a large impact on carcass weights and performance. But we saw the better results and a more effective way was to focus on PE and DF. Data from these studies kind of showed us that. So increasing that physical effectivity of that diet by increasing PE and DF, increased dressing percentage by 0.3% on average, and also increase the proportion of cattle that was graded triple A. So that was really interesting too. However, we saw that look at not just our experience with the studies here, but also from other studies from the literature, we see that changing PE and DF by changing particle or chop length was very hard. You can change it a little bit, but very minimally. So it's much easier to change PE and DF by changing forage inclusion, adjusting forage inclusion, and ensuring you have an optimum particle size, then changing a lot particle size of that diet, of that chopping of that forage. So that's something to think, because very often people are trying to make it too large, and then there is other issues like sorting and so on that can happen. So I would say make sure you have an optimum chop length for that forage, or if it's silage or whatever you need. Make sure it's not too small that you're losing that physical effectivity of that forage. You want to make sure we have that. But then adjusting PE and DF, it might be easier to do by adjusting forage inclusion from that forage specifically in the diet. Other questions that we have was that, does it matter if I change the forage quality? And what we saw, it does matter. Like this study we had cattle fed barley silage or wheat silage. Both had 10% of on the diet dry matter. And we saw the difference in NDF of the diets was from 19.1 for barley silage to 19.5. And the amount of UNDF was 6.7 in the barley silage to 7.2 in the wheat silage. And we saw that by increasing just a little bit NDF and UNDF, we saw that we had decreased performance hot carcass weight and back fat thickness for wheat silage, right? So we got to be careful of that. It would be interesting if we could repeat that study and adjust to make sure reduce inclusion of wheat silage to have equal amounts of NDF and UNDF and see if we would get exactly similar performance, right? That would be kind of interesting, but that we couldn't do that. It was post fact that we looked at that. Another study that we looked in terms of trying to look at forage inclusion to manage acidosis and its consequences of acidosis, like liver abscess, um, was trying to alter the forage inclusion throughout the finishing phase. So in this study, we did this because there's a lot of studies that say, okay, increase forage, decrease liver acidosis, and decrease liver abscess in cattle, right? Some older studies kind of show us that, but we know that we also have decreased performance, decreased gain to feed ratio, right? So what we did was like, let's try to protect cattle maybe earlier on when they're still adapting to that high grain diet, and then once they are more adapted, slowly decrease the amount of forage, and then feed less forage in the last portion or the last half of the finishing phase, and then overall use the same amount of forage and see if we can reduce liver abscess, but at the same time maintain performance and gain to feed ratio similar. So that's kind of what we did in this study, where we have a control diet, which we fed 7.5% forage on a dry matter base in the form of barley silage from the beginning to the end of the. So we had 4 periods of 42 days each. And then our positive and negative control is just inclusion of tylosine in the positive, and negative control is no tylosine as a form of controlling or preventing liver abscess. Um, and then our decreasing strategy, we started with 15% in the first period of forage in the diet dry matter, went to 9% in the second period, and then 3% in the last half of the finishing phase. And then we did the increasing or the opposite of the decreasing, just to we didn't think it was going to be better, but we just wanted to have an opposite to compare to see what would be the impact of that. So this is the diet we fed, right? The different 15, 9, and 3% forage inclusion, and then the control diet with 7.5 forage inclusion. And our barley, we fed barley grain and wheat grain, 50% of each, and we added some wheat grain because we wanted to challenge that rumen to have more acidity and promote have conditions to have liver abscess. Because if you're studying liver abscess, you don't have any liver abscess happening, then you can't really measure anything, right? So that's kind of the idea. We wanted to have some acidosis happening, or at least challenge it a little bit. And the interesting thing that we found is that our decreasing diet that had no tylosine to control liver abscess was able to show the performance, the growth performance results in terms of dry matter intake, average daily gain, gain to feed, that was very similar to the positive control diet. So it was a interesting way. We were able to maintain average daily gain, even though we started with more forage and finished with less forage. But that increasing diet that had more forage in the end was definitely not a good idea. You can see that the average daily gain was lower, total weight gain was less for that treatment, and then it wasn't a good strategy. When we look at the carcass data here, you can see that increasing diet, of course, had lower carcass weight because of that. But our control, positive control and decreasing diet had very similar results in terms of carcass weight, dressing percentage, back fat thickness, and ribeye area, marbling scores, and all of that, which again was very interesting. And on the top of that, we really were focusing that study more on liver abscess, right? And you can see the problem is it's very hard to study liver abscess. You need a lot of cattle. So even though we were using I believe it was 360 head in this study, we thought was a large study for our facility. It's still a very small study for a liver abscess study. So we see a trend that with the control treatment with liver with tylosine, we get a reduction in liver abscess here, a little bit of a reduction. And we saw similar result as just a numerical result here for our decreasing strategy. But we did see a significant effect for this is total liver abscess on the top for a reduction for minor liver abscess. You can see almost 50% less here for the control with Tylosine, and the same kind of similar amount for our treatment, decreasing treatment. And the negative control without Tylosine and the increasing, both of them had larger quantities of small liver abscess, but no difference in the severe abscess, liver abscess that was unfortunate. So for this, we saw that we definitely don't want to use increasing, start with very low forage and then finish with high forage. But we saw that our decreasing diet, we starting with more forage and then slowly reducing and having lower forage inclusion later on in the finishing period, just giving more time for that cattle to adapt and be able to absorb more those short-chain fatty acid better, was a good way, and was able to promote similar performance than a controlled diet with low, more constant forage inclusion and with Tylosine in feed to control liver abscess. So an interesting result. Just to finalize here, there's like a kind of figure that's interesting that Dr. Penner put together that kind of trying to link a lot of issues we see in terms of management issues, in terms of bunk space, stocking density, transportation, or diet effects, or environment, or disease, or even animal behavior. All of those that can lead to transient low dry matter intake or feed restriction, or situations of off-feed events. All of those will impact the ruminal and intestinal epithelium and will reduce absorptive and capacity and surface area, and will disrupt barrier function. On those animals, that the reduction of that gut barrier function, and all of that will lead to decreased ruminal and post-ruminal pH, right? And then that will lead to more passage to the blood of endotoxins, right, and bacteria, and those will cause liver abscess and other secondary disease, right, like laminitis and so on. So that's kind of one of the thinking so far, really trying to prevent some of the outcomes in terms of intake here. It's going to be important. So in terms of strategies to mitigate ruminal acidosis, we really need to focus especially in these two areas in green here, trying to manage the fermentability. We got to be careful because we don't want to reduce too much fermentability so that energy is intake or energy, overall energy is reduced to cattle, because we want to maintain growth performance, but we want to fine tune grain processing. We want to fine tune the amount of starch we have in the diet, and that can be by increasing fiber, byproducts, or fat in that diet. But we really have a good feeding management in terms of how frequent we feed. We have good bunk management practice so cattle are not getting hungry. We need to avoid those periods of feed restrictions, and we need to really make sure that we promote a proper dietary adaptation or step up of those cattle. So just to finalize then, really, we really need to get that dietary adaptation done properly, adequate grain processing to really minimize fines, ensure we have enough fiber or NDF from forage in that diet would be really important. Make sure that the quality of that fiber of that roughage is important too. As you feed like a very, very low quality fiber, you can have high UNDF, and then that can decrease your performance. That's going to be an issue. So making sure we have enough physically effective NEDF to stimulate chewing, rumination, but also ruminal contraction will help also kind of buffer that rumen. It's going to be important. We saw that some of those, we can use some of that strategy to alter roughage inclusion throughout the finishing phase, and that you can protect maybe periods that cattle might be at higher chance or risk of having ruminal acidosis. But then there is opportunity for later stages to decrease quite a bit forage inclusion and still get a good outcome in that finishing phase. But you can't do any of that if you don't have good feeding and bunk management practice. So we really need to make sure we don't let cattle get hungry and we don't restrict cattle feed. So that's what I had. Thank you for the invitation, and I hope I'm not sure if I have time, but I hope I can answer some of your questions.